Hello and welcome to another episode of You Can't Handle the Tooth. This is Dr. J, the real floss boss. The last one we did got over 10,000 views. I mean, I'm really impressed and really grateful for all of the feedback that I've been getting. And we have another good episode for you today. Thanks for participating. Thanks for giving me subject matter to talk about. I wanted to mention one thing before we get started. And first of all, we want you to know that our thoughts and our prayers are with all of those that have been displaced or affected negatively by Hurricane Harvey and Irma. We were lucky here in South Carolina and missed it. We got a little bit of rain and some wind, but nothing like those that are coming up the Panhandle in Florida or in Houston. And was thinking, what can we do, right? As a small dental office, what in the world could we do to help? So what we've decided we would do is we're going to take, for the next little while, we're going to take all the proceeds from any whitening that gets done in our office, and we're going to give those proceeds to charity to help these people rebuild, help them with food, water, whatever it is that they need to. We've got a charity picked out that we're going to use. And so all the proceeds from any type of whitening that we do for the next little while, at least a few months, we will make sure and get those proceeds to a good cause to help with the hurricane relief. Okay? Now, our episode today is on radiation. I mean, all the time people tell me that this always getting x-rayed and too much radiation. I've had people very close to me who've had cancer and who've had to get radiation treatments, and so they don't want to get a lot of exposure to unnecessary radiation. And so very often if a patient says, I don't want to get x-rays today, I always want to ask why, because it could be money, it could be, they don't have insurance. And then some people, it could be that the fact that they don't want the exposure to the x-rays. So I wanted to put a little perspective on how much radiation you're getting when you're in a dental office. And the other thing I wanted to do is sort of address why dentists need to take so many x-rays. So what is recommended, everything is person to person. So there's not some standard where we go, a human walks in, they're getting these x-rays. If a 21-year-old walks in, hasn't been to the dentist in a while, and we're probably going to take, a panoramic x-ray, one that will help me look at the wisdom teeth a little bit. If you've got an older person who's been in pretty regularly, who just moved here and just needs routine care, and it's been over a year since they've had any dental x-rays taken, we'll probably take some bite wings at the very least to take a look and see if there's any cavities under there. What do the x-rays show us? So when I pull the cheeks back and I look around, I can see stuff. But my eyes, since I'm not Superman yet, I can only see so much with my eyeballs. And so I require x-rays so that I can see the density levels of the teeth. That's what the x-rays really show me. They show me the density of bone, so I can tell if there's some infection going on down in the tooth. They will show me fractures sometimes, and I can see that. Sometimes they show decay, and I can't. A lot of people will say, "Well, I see that you see a cavity there on my X-ray, but it doesn't hurt me. This tooth doesn't hurt me, so I don't think I want to treat it." And that's totally fine. It makes no difference to me how you want to treat yourself dentally. But if you want to keep your teeth for a lifetime and you don't want to spend a ton of money on dentistry, then early is better. Early is king. So if you can't feel it, if it doesn't hurt and it exists there, that may be the time. It's sort of like a nice lake maybe, but you don't know that there are alligators lurking underneath until they come up and bite you. If you don't know they're down there, then you just keep swimming. But if you realize, oh my gosh, maybe there's some alligators under there, sharks, you can use whatever analogy you like. But that's what the x-rays do. They sort of help tell us what's going on underneath there, in the areas that you can't see. So when teeth start to hurt, when they're sensitive, when they're achy, when your gums are inflamed and red, it's usually beyond the point of something simple or something cheap. So that's why radiology, radiographs or x-rays, that's why they are a useful tool in diagnosing conditions of the teeth and the mouth. All right. Now, perspective on radiation, because this is big. People think, oh, the radiation. So, for years and years and years, traditional X-rays were taken, and that is, they put the film in your mouth, they take the X-ray, and then they have to take that film and they go and develop it in a developing room, and it takes about 3 or 4 minutes to get these things developed. That is what I would call conventional or traditional dental X-rays. There are still dentists who do it this way, and there's nothing wrong with that. It's a great way. It's very good diagnostics. The advantages to traditional is the picture is very clear, and it's relatively cheap. If you upgrade to what's called digital X-rays, it can be very expensive for the dentist, and but there are some advantages of that too. The advantages to digital X-rays are they're done in an instant. So just as soon as you hit the button, bam, it's on the computer screen and you can see it. So you don't have that lag time of 3 or 4 minutes per film to wait on. So it comes up instantly. It's bigger and crystal clear, so you can see it better. You can even use contrasting paints and stuff to help with the diagnostic effort on the computer. And certainly storage. You don't have something hard that you have to store. You can just store these on a hard drive, and it's easy to store too. So the difference though in the radiation, although I'm not going to say conventional X-rays, the radiation dose you get with that is bad, because I don't think that it's bad. I just think it's a lot better if you do digital X-rays. Okay, so I've got some numbers. I wrote them down, so I want to make sure I get them right. These are all estimates. X-rays, the amount of radiation you get, they can be measured in different units, but the kind of units that we're going to talk about are microsieverts. And so those are the units of how much radiation you're getting. And so I wanted to give you a few examples. So on a single X-ray, a one X-ray, bing, conventional style, you get 5. You might want to write these numbers down because it's going to get confusing. A conventional X-ray, you get about 5 microsieverts, and with digital X-rays, you get 1. So digital X-rays are literally, the number is 70 to 90, so we'll just say 80%. 80% less X-ray, less radiation with digital X-rays, okay? Less radiation. So you really, it'd be nice to have digital X-rays done, but still not bad, as you'll see, as I'm going to talk about some other common things that we get exposed to X-rays, radiation. So a full mouth series of X-rays, bing, 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 bing. They take 20 or so pictures around all of the teeth, and with conventional X-rays, you get 100 microsieverts, okay, of radiation. With digital X-rays, you get 20. And with a panoramic X-ray, the one that goes around your head, often used for wisdom teeth evaluation, you get 80 with conventional and about 15 with digital. Now, what are some other things? And you can look up this stuff. Like I think I read if you eat a few bananas in a day, you get like 10. Okay, so that should. I'm just trying to let you know that you're exposed to radiation just for living, right? I mean, the sun is far away, but it hits us every day. In fact, every day, just for living, we get about 17 microsieverts per day. 17, okay? That's just in a day of existence. If you want to take a plane ride where you're up higher, closer to the sun, from New York to LA, you get 40 microsieverts. That's a lot. I mean, it's not a lot, but relatively speaking, you wouldn't suspect that you would get that much radiation. Mammogram, by the way, is 400. There may be newer technologies now that has brought that number down, but if you Google it, you'll probably find it's about that much. So the point is, X-radiation in a dental office setting, relatively speaking, is pretty low, and it's in most cases, it's still not indicated. If you're pregnant, you're not going to do that. You're not going to take an X-ray. But if you had to, the dosage is pretty low, right? I mean, just compared to everyday living, and that's kind of what I wanted to point out. So it's about 70 to 90% less radiation with digital, and even so, in 3 or 4 days' time that of just living, that's the same as a full mouth series of X-rays. And so I don't want you to be so apprehensive when you go to a dental office about the radiation. Now, if you're undergoing some sort of radiation therapy already, it may not be the best time, because you don't want to add even just a little bit to some other exposures that you might be getting. But be leery of it. Make sure that your dentist or assistant or hygienist provides you with a lead apron, covers all the vital organs when they're taking the x-ray. And you can always ask them if they have digital, and if they don't, ask them why. And it's okay if they don't. There's plenty of dentists that still have conventional x-rays, and I'd go do it. I wouldn't care if my kids went and had a traditional x-ray. So this is not about saying that that's bad. It's just there's a better way with digital x-rays, and so hopefully your dentist has that. And it's also about keeping perspective for you, just so you're not so leery or apprehensive when you go into a dental office. Okay? So that is all I've got about digital x-rays and dental x-rays compared to the kind of radiation we get when we just exist. So please send questions. This is pretty controversial stuff, so I'll probably get a few questions on this, but I welcome them. And I also welcome the topics and comments that I get. I love when patients come in and they're like, hey, I saw the episode you did last week. Could you do one on this? Somebody asked me just this week about the long-term consequences of root canal treatment. There's an article published not very long ago that has sparked some controversy, and so we'll be doing a Facebook Live on that pretty soon. All right? I want to thank everybody again for watching these episodes. I appreciate it, and keep the comments and suggestions coming. Thanks again. This is another episode of You Can't Handle the Tooth. This is the Floss Boss with Dr. J, and I will see you next week.